It affects an estimated 50 million men and approximately 35 million women. We are talking about hair loss today. Dr. Chafu is here to help. Dr. Chafu, good morning.
Good morning, Charlie.
August is National Hair Loss Awareness Month, and there are a lot of people dealing with it.
There are, and you know, oftentimes we don't really recognize, or I'll see patients in my office, or my wife, who's our dermatologist, will see women for hair loss. And you're right, you know, you don't really have symptoms often. You actually have to lose half the hair in a certain area of your scalp before we notice clinical baldness. So you've actually had quite a long history of hair loss. And when I ask patients, and how long have you noticed this? They'll say, well, just the past few years. And they say that because it's only those past few years they begin to notice their scalp through their hair.
You wrote this book called Hair Loss Solutions. Over the years, I have heard so many myths about don't use hairspray, you'll lose your hair, don't use this product, don't put heat, don't color. I mean, I could just, it's almost comical, some of the
You're
things
right,
that I
and it's
hear.
so hard for people, Charlotte, to navigate the healthcare system, to know fact from fiction. And so Susan and I wrote this book to really, I call it kind of the cliff notes, or it's from my experience talking to patients over the years, because it's really, it's not written as a medical book, but it's written for the public to understand hair loss. You know, what are the different causes, the symptoms, what are the various types of treatments, depending on the type of hair loss.
What are the biggest causes to lose your hair?
So the main cause of hair loss is something called androgenic alopecia, AGA for short. It may be hereditary, but it may not. It's about 95% of men, this is the main cause of their hair loss. However, in women, it's about 45%. But we don't want to forget there are other causes. Of course, when we had COVID, and the stress from the COVID can cause a temporary shedding of hair. So we know stress, we know high fevers, anxiety, depression, any life event can cause a temporary shedding of hair. But then there are medical causes. There are drugs that can be related, chemotherapy, radiation therapy. There are autoimmune disorders. So you're actually, as a physician, you're almost like a detective. You really have to look at the history and get a good examination to determine really what the cause and what the treatments are.
But isn't just aging a huge part of it?
Part of it, yes, you're right, because in men, as we said, 95% is androgenic alopecia, or male pattern baldness. 40% of men at the age of 40 will suffer from hair loss, 50% at 50, 60%, and so forth. So there is an obvious increase in hair loss.
Is the hair loss different between a man and a woman?
It typically is, Charlie. So typically in men, they will begin to lose the hair in the frontal area or sometimes in the crown region, whereas in women, it oftentimes tends to be more diffuse, if you will. So a lot of times women will notice along the part line, and it just begins to thin out from there. But there is a variant of female pattern hair loss that may present more like male pattern hair loss, more like the recessions.
A friend of mine, shall remain nameless, through incredible stress of just her son getting in college and applications, just the other day showed me that she had lost so much hair on the top of her head, and she was hiding it with a scarf. She was devastated, and I said, what happened? And she said, it's because of stress. Yeah,
and we call that in the medical field called telogen effluvium, or TE for short. And you're right. So any kind of stressful event, like your friend's trying to get her son into college, a divorce, a bankruptcy, a job change, COVID, there are so many different causes. The good news about that for your friend and many other people, with that type of hair loss, it tends to be temporary in nature. And so it's that time, once we get past that stress period, typically the hair follicles will recover and will begin to regrow again.
Well, we'll have to have you back, Dr. Chafu, because as much as we talked about the hair loss, there are so many things that are nowadays just available to be able to help people. So maybe we'll have you back and talk about those
Sounds good.
at that time. Thank you for being here. Always good to see you.
Good to see you.